Hi everyone, welcome back to Medical English Pro, the channel where medicine meets language. Today, we're diving into one of the most powerful tools in medical English, modal verbs. Whether you're a doctor, a nurse, or a medical student using English with patients or colleagues, you must master these. Stay with me until the end because I'll share the 3 biggest mistakes medical professionals make with modals and how to sound confident and natural instead. Section 1. What are modal verbs? Modal verbs are small words with big power. They show necessity, advice, or possibility. In medical English, they can completely change meaning. Let's look at this. You must take this medicine. It's necessary. You should take this medicine. It's recommended. You could take this medicine. It's an option. Same sentence, totally different medical impact. Section 2. Must versus have to. The doctor's orders. In consultations, we often express obligation, but should you say you must or you have to? You must means internal obligation or strong advice from you as the medical authority. You have to means external rule or necessity, like hospital policy or protocol. In patient communication, have to often sounds softer than must. Examples. You must rest for a few days. Doctor's personal advice. You have to fast before surgery. Hospital rule. Section 3. Should. Gentle professional advice. Next, let's soften the tone. You don't always want to sound strict. Should is perfect for giving advice without pressure. Examples. You should drink more water. You should monitor your blood pressure daily. It's polite, caring, professional. Which sounds better? You must stop eating salt. You should reduce your salt intake. Number 2, right? Sounds much more patient-friendly. Section 4. May, might, could, possibility in diagnostics. These are the modals of uncertainty, essential in diagnostics. Doctors rarely say, you have immediately. Instead, we use, you may have an infection. It could be a viral illness. This might be due to stress. It shows professionalism and caution, very important in medical communication. May, might, could express different degrees of uncertainty. May, 60%. You may have flu. Might, 50%. It might be stress. Could, 40%. It could be allergy. Using these modals makes your language accurate, respectful, and medically safe. Section 5. Can and cannot, ability and permission. Doctors also talk about ability and permission. You can walk now, ability after surgery. You can take this medication with food, permission or safety. You can't eat before the test, restriction. Section 6. Modal verbs and hospital communication. Let's see how modals appear in real hospital talk. Doctor instructs patients like this. You should come back in a week. You must call if your symptoms get worse. Nurse says to doctor, the patient may need another dose. Doctor speaks to team. We might have to admit her overnight. Section 7. Common mistakes. Let's fix the 3 most common mistakes medical English learners make. 1. Saying, you mustn't eat much salt, when they mean you shouldn't eat much salt. Mustn't means forbidden, shouldn't means not recommended. 2. Forgetting the base verb, not you must to take medicine, but you must take medicine. 3. Overusing can instead of may. Not you can go home now, but you may go home now, more formal in hospital contexts. Summing up, modal verbs aren't just grammar. They're part of how you sound as a professional. If you want to sound like a confident healthcare provider in English, remember this. Must for rules, should for advice, might for uncertainty. Keep practicing, and soon you'll sound as fluent and professional as you are skilled. Don't forget to hit like, subscribe, and comment below with one sentence using a modal verb in your medical context. Follow for more Medical English Pro.